The overall goal of these procedures is to help treat patients with pneumonia using osteopathic manipulative medicine. These methods help remove any restrictions that might be limiting thoracic cage mobility and lymphatic flow, and augment the body's ability to fight off infection by promoting the body's immune system. This is accomplished by first treating any restrictions to terminal lymphatic drainage at the thoracic inlet. Treating first rib somatic dysfunctions can remove restrictions to lymphatic drainage and improve upper rib cage mobility. The second step is to help improve diaphragmatic mobility by treating the abdominal diaphragm and ensuring optimal excursion. Next, any rib restrictions along the thoracic cage are addressed by performing seated rib raising. This gently articulates the entire rib cage and helps improve rib motion to improve thoracic cage compliance, and assists in maximizing pressure changes in the thoracic cavity with breathing. The final step is the thoracic lymphatic pump technique, which promotes circulation and lymphatic flow. Ultimately, osteopathic manipulative medicine has been shown to be a potentially helpful adjunctive treatment for patients with pneumonia.
Osteopathic Manipulative Medicine, or OMM, is a hands-on approach which has helped patients with pneumonia since the late 1800s. OMM is a gentle procedure that could help remove musculoskeletal restrictions and promote the body's own self-healing mechanism.
Treatment with osteopathic manipulative medicine is based on an understanding of the anatomy and physiology of the body. Each of these techniques assess and address potential musculoskeletal restrictions or somatic dysfunctions that, if present, could potentially prevent and delay the patient's ability to heal.